Dr. Ravi Patel with the Comprehensive Blood and Cancer in with us again this morning. As always, Doc, thanks so much for coming in.
Thank you.
You come in every month to answer some cancer questions, some common ones. This one's probably targeted more towards a younger set. Does indoor tanning give you some kind of protection from cancer, particularly skin cancer?
No, and that is a problem. Roughly, and like you said, the younger age group, the teenagers, particularly when the proms are coming up, are trying to get suntanned, and roughly speaking, about 2 to 2.5 million younger teenagers get tanned during the year, and there is a definite increase actually in melanoma in people who are exposed to tanning before the age of 35.
We're talking about tanning beds, right?
Tanning beds.
Right.
And even
there was the spray tans, right? Does the spray tan help you at all?
Very good point. And I think spray tanning is a good way to go. It's very, it's a little difficult, but it's quite protective.
Yeah. Does it give you an SPF factor at all by using a spray tan because it darkens your skin a little bit?
It does.
It does.
It does. Not a significant amount, but it's a good way to get yourself tanned.
And better than using UV.
Yes. And teenagers, the problem is they always think that nothing's going to happen to them. So a good deal of education on preventing melanoma. It's the most rapidly rising cancer right now.
And is there a new drug for melanoma treatment? That's the second question we got this morning.
Yes, there is actually, and there's been a great buzzword of personalized therapy, but now the new buzzword is how can we stimulate the immune system to attack the cancer. So they've developed a drug which triggers the T cells in the body to attack melanoma cells. So a lot of hope for patients in whom melanoma is spread to other parts of the body.
Okay, and speaking of cancers, let's talk about a different cancer, prostate cancer. Do you have to take hormonal therapy in addition to radiation therapy or surgery for prostate cancer?
Not always, but sometimes what happens is if the cancer is large and you're delivering radiation, you can target it better if you give hormonal therapy. And there's more data which shows that if you combine what is called testosterone blockade and the radiation, you achieve better results.
So the cumulative effect is better sometimes in certain patients. Really quickly, I know we have a couple seconds on this. Cancer clusters. Aaron Brockovich was up in the Senate testifying about this in front of a committee yesterday.
Yes.
Two of the places here in Kern County, Rosamond. Is there really an idea that there's certain areas that have more cancer than others? Is it power lines? Is it something in that particular area? Is it something in the water?
For specifically Kern County, so far based on the studies, as we were discussing, the studies have been sort of inconclusive. And, cancer clusters means the same kind of cancer or similar kinds of cancer and higher incidence rates. And comparable data with the state registry has not reflected that so far, So that is a problem.
There's a lot of anecdotal evidence. There'll be somebody who says, I got a lot of prostate cancer here in my family. We've all lived here. And then another person says, I got throat cancer.
Yes.
But it has to be the same type of cancer.
Same type of cancer, and a higher incidence compared to national averages.
And we don't have that just yet.
We don't. There were 2 EPA studies done also to look at it, and not conclusive.
But it's something to still look at.
No, it's definitely something to look at for the benefit of the patients.
Absolutely. Dr. Ravi Patel in with us with the Comprehensive Blood and Cancer Center. As always, thanks for coming in.
Thank you.
Interesting stuff. We'll take another quick break here this morning. We'll be right back.
Every year, close to 200,000 men are diagnosed with prostate cancer. Nearly 30,000 will die. There's a drug that can extend patients' lives by a matter of months, but it's not without controversy. 17's Tammy Melchuk is here now with details and your chance to weigh in.
Well, Robin, that drug is called Provenge, and it was approved by the Food and Drug Administration last April. Just yesterday, however, Medicare officials announced they would cover the treatment. Provenge stimulates a patient's immune system to target and attack the prostate cancer. The Comprehensive Blood and Cancer Center in Bakersfield is the only place in the Central Valley certified to administer the treatment, but at a cost of $93,000. Some argue it's just another high-priced cancer treatment without much benefit.
Well, it is not going to cure the prostate cancer, so we don't want to say that this method is going to cure prostate cancer. It is going to make you live longer, and based on the studies, it shows that it could give you an additional 4 to 6 months in prolonging your lifespan.
Tonight we're asking you, is it worth spending $93,000 to extend a prostate cancer patient's life by 4 months? Call us at 283-1800, enter category 1000. Press 1 for yes if you think it is worth the cost, and 2 if not. You can also leave a voicemail at category 1017 or email your thoughts to poll@kget.com or join our discussion on our Facebook and Twitter pages. I'll have some of your responses coming up at the bottom of the hour when I get the first numbers. Jim and Robin?
All right, Tammy, thank you. New at 6, standout.